Hello, everyone. Welcome to our presentation for Milestone 4. We are the care of the critical care client group, and we did our presentation on the evaluation of the effect of early fluid resuscitation and high-dose vitamin C on mortality rates in sepsis patients in an acute care setting. We're student nurses at the Louise Harrington School of Nursing in Nursing 4351, Professional Nursing Development, a Consumer of Research courses. I'm Mallory Sanders.
I'm Elizabeth DeCiccio.
I'm
I'm
Casey Coffin.
I'm London Little.
So the purpose of this article will be to synthesize the literature examining the effect of high-dose vitamin C fluid administration in early treatment of sepsis as compared to current standard sepsis protocol that lacks vitamin C therapy among adult patients in the critical care unit.
So, sepsis is a dysregulated systemic response to an infection. It is a problem commonly found in critical care settings, and it accounts for nearly one-third to one-half of possible mortalities. And it is also the main cause of death in critically ill patients. The key to overcoming sepsis is early diagnosis and treatment, which is why it is very important as nurses to be able to recognize the signs and symptoms so we can account for early diagnosis and treatment. In regards to search techniques, we utilized Google Scholar, and we searched for clarifying keywords such as sepsis or vitamin C. We were able to filter out certain articles by selecting dates between 2020 and 2025, and also excluding literature review articles. The Journal of Intensive Medicine was used as well, and we were able to specify certain categories such as nursing, intensive care, and sepsis through this search engine.
So we chose six articles that are all peer-reviewed articles of different categories, some qualitative, some quantitative. So one of the articles we chose was from 2020. It was a randomized clinical trial where they used several different monotherapies as a conjunctive therapy for septic shock patients, and they compared their effectiveness such as vitamin C in some patients, vitamin E in another patient group, and a couple other groups as well. They used like N-acetylcysteine and some other different ones, and then they had a control group as well of non-antioxidant treatment. Other group used high dose vitamin C in sepsis patients that were specifically on a mechanical ventilator. That was a relatively small trial in 2022. There was also a study we used that tried a combination approach with vitamin C, thiamine, and hydrocortisone in a clinical trial, and that was also a smaller study group. There was a larger study conducted with vitamin C in sepsis patients in ICU that had 752 participants. That was performed in 2022. Our qualitative studies that we utilized one of them was done in 2021. They recognized the need for prompt fluid administration, and to do that, they stated that they needed nurses to have a broader scope of practice in order to be able to act faster. Another qualitative study performed in 2023 said that we needed higher staffing rates in order to actually give patients that are in sepsis the proper care and treatment that they need. Some of these synthesis findings that we compared and contrasted kind of bring all of these concepts together. So, above all else, every single study recognized that there is a critical need for improvement in the protocol for sepsis treatment because the death rate is so high in sepsis patients. Um, One of the studies that was comparing the fluid administration needing to be done in early stages and that it's beneficial for all patients, that was actually resonating through all studies as well. There wasn't a single study that said that early fluid administration wasn't critical to the patient's success. There was also some conflicting data in our research. Some the researchers did not expect as well. So in our large study trial, conducted in 2022, there was a high mortality and organ dysfunction rate in this vitamin C group. In a smaller trial performed in 22, it was the opposite. They had low mortality in ventilated patients with sepsis, in the vitamin C group. So that's a bit where our data doesn't go together, it contradicts one another. There is some things to be said with the trial that had the monotherapies because they also had success with the vitamin C administration as well as some other antioxidants that they administered. So that kind of matches the Eldrini and others study that was done, encouraging that lower mortality rate with vitamin C. So there's just some different results. So further testing needs to be done for sure on that. The the study that had the qualitative data, they said that the one in 2021 said that there is a need for the expanded nurses in the scope of practice because while fluid administration is important and everybody acknowledges that, they feel like it's not being done fast enough because it's not within the nurse's scope to recognize sepsis and administer it immediately. They have to wait for orders. And that's a current problem that they saw. Later, there was a 2023 study conducted, and they said that there also needs to be a larger staff requirement at the hospitals in the ICU unit because sepsis requires early identification, needs high education training in order for faculty to be able to recognize it early and act promptly.
Yeah, so kind of jumping off of that, in terms of like how this kind of relates all back to like our research-based nursing practice, I think what these articles highlighted the most for us is how we can use these kinds of research articles, to better our practice as nurses, especially when it comes to those fluid resuscitation trials that they did, interviewing nurses and seeing where they thought things were going wrong in terms of identifying sepsis and the barriers they were encountering, getting people that fluid administration. These studies were done in Australia, so at the time, nurses weren't able to give fluids without a doctor present or ordered in their sepsis or without it being ordered in their sepsis protocols, even if it was back timed, it seemed. So that was a huge barrier for them in being able to get those fluids to patients in a timely manner. And kind of like broadening that into like a larger topic, I think as, especially in terms of research-based nursing practice, like as nurses, working with leadership, working with the interdisciplinary team, identifying barriers, developing protocols so that patients are getting the most efficient, care possible, and the best care possible is something that's really, really important. And since nurses are often the first ones to see these patients, the first people to assess these patients, and are often the ones spending the most time and are usually the ones that are going to be encountering the most barriers, it's really important to have that communication with your leadership, your team, reaching out to like even like your state or local government saying like, hey, this is a problem that we're encountering and we need a solution to it because we think that and we know by getting these patients fluids faster in this situation, we can decrease mortality rates and decrease negative outcomes. Continuing on through that with the vitamin C trials, like London said, we kind of got some mixed results in those trials, and obviously further research is needed to, adequately determine if this is something that should or should not be implemented into, um, formal sepsis protocols. But I think just like it highlighted that being up to date on research, seeing where being able to evaluate where something helped versus where something hurt based off of studies can really help, nurses add to the conversation with the interdisciplinary team. If you have a patient who's not getting better and you're trying to do a huddle with your team and trying to figure out what to do next, being informed and basing your opinions off of research and keeping up to date with latest studies can really help, advance the care of that patient. If you're, in a room with a doctor and saying, hey, like I read this article about vitamin C and it really helped in the large study where there weren't great outcomes with vitamin C. It actually showed better outcomes with COVID-19. And it showed better outcomes with vented patients. So maybe vitamin C works better with patients with lung issues. But it doesn't work great with patients on vasopressors, it seems, and adding that little bit to the conversation could really advance the patient's care and throw out ideas to the doctor and working together on all of that. All this to say, nurses wear a lot of different hats. So it's important that, we're staying up to date in research and we are making sure that we're being communicative with our teams and basing our practices off of research, and making sure that our protocols are ensuring the best care for our patients.
So our main points that we took away from all of our research is that fluid resuscitation is showing very promising research in sepsis management, as Elizabeth was talking about. So it is very important for us to advocate for that being a big portion of the sepsis protocol. And then there's also further research that needs to be done in regards to vitamin C therapy. There was those conflicting results. So more research into the subject is going to give us a lot more clarification into when vitamin C is useful and when it may be a little bit more harmful to our patients. But advocating for that research and staying up to date on what the research is telling us can be very instrumental in how we care for our critically ill patients. And then on top of that, we need to stay on top of ourselves as nurses to continue to seek education on how to identify sepsis and initiate those protocols quickly so that we can get to these sepsis patients and get them started as soon as possible. And then, as I said, we just need to stay on top of the research. We are advocates for our patients, and so being able to understand the research and know what's out there allows us the best opportunity to advocate for the best possible care for our patients. So we've included our references below, and thank you for listening to our virtual poster presentation.